Hello guys, so today we got Josh, one of patients who's come with hip problem is something which we routinely see in Harley Street. So what I decided to make this video is like your typical presentation of a young male with hip impingement, which sort of can usually not be picked up because it's hip flexor injury. Right, yeah. So and most of them tend to have hip issues. So Josh, you're having this long-standing hip issue. So tell me how long it's been a problem.
Around 3 years. I believe I ruptured it when I was at an expo. I could barely even move my leg after I'd actually caused the injury, and then after that it just never been the same. It was impinging.
What age was it?
21.
21. Okay. And obviously you've been diagnosed with hip flexor injury. When did you actually notice the limitations of squats and things like that? When did you feel like you had some restrictions?
So probably after, I originally went to a physio. I didn't follow any of the advice because I started feeling better. So then I got back straight into training, and then it was after probably around 6 months to a year when I really started noticing that it was affecting my my squat pattern, my lunge patterns, and then also affecting my knees to a degree.
And did you have back pain as well?
I had back pain.
Yeah. So this is something which we see common is when you lose the movement in your hips, it affects your back as well. So a lot of them usually have back pain as well. So did you try to force your squat into that narrow stance and things like that?
A couple of times, yeah. Or the leg press, I would, because I wanted to hit a certain muscle a little bit more, so I would force myself into that position, and that's when it would really be
beyond that.
Yeah.
On a day-to-day symptoms, what are your key symptoms when you feel like, what sort of things you feel it more?
Sitting down for longer periods of time, I would feel an impingement.
Deep squats,
yeah.
Especially, but nothing should be fine.
Walking in and stuff is
So the typical pattern which we see is the sitting intolerance. If you sit in a low sofas, low chairs, very sinking in,
right.
The hip is a problem.
Yes.
So general advice we tell them is making sure the hips is always 2 inches higher than the knees. So you're having that bit of clearance.
Okay.
So if you're sinking it too low, then you're really irritating that. You're not causing any damage, you're just irritating the front structure.
Okay.
So the position can make a big difference here. So let's look at your classical squat pattern here.
Okay.
So if you just stand here, what I want to do is put you in an artificial stand here. Keep that sort of narrow stance here, hands up in a full overhead squat. Go as you're shifting, isn't it? So you sort of go over there. Do you feel any pinching?
Yeah, definitely.
You feel on that. So clearly, I don't have to push you more on that.
No.
So try to open up your legs, squat, femur out, and just lift your hand. Keep your hands forward and just squat much, nice and loose.
Yeah, much
more. So I think the narrow stance clearly doesn't suit somebody like you who has a hip impingement.
Yeah.
So that's the key thing. So if you lie on your back, please here. So the first thing, most of the people with impingement naturally have an externally rotated, attitude of the foot here. So as you can see, it's sort of naturally they don't, because there's a lack of internal rotation, you naturally fall out. How long you notice this sort of your foot turning out?
Prominently the last 2 years. Yeah.
So the key thing is to see how they do the hip flexion in a neutral stance. So one of the things I always check is putting them into neutral and see how much they can flex. So as you can see, the flexion has quite a decent flexion on the right here, but the moment you just put them into internal rotation in the midline, and when you put them into hip flexion, that's pretty much it. He hits the blocks around 90 degrees. You feel that. You can feel that. So a simple flexion is all you need to really get that sort of symptoms here. And while you're here, you might well do a little bit of a log roll. Any pinching, peeling when I go in? Anything on that?
No, that's actually okay.
That's over the FABER distance. So what we know from the literature is when you have a lot of FABER distance on side to side, it usually indicates, from research from Mark Philippon has shown that it's linked with high alpha angle difference. So, it's got that sort of classical young male cam presentation. Did you do a lot of rotational sports when you're young?
So, yeah, I did boxing for nearly 10 years.
Yeah, so normally we see people in boxing, basketball, football and things like that, where you're getting that. Now, the big question is internal rotation. So normally we like to see at least 15 to 20 degrees. Now, I'm not even expecting 10 degrees here. So if you take into 90 degrees here, and as you can see, he just has not even 5 degrees. That's pretty much, which is, for a deep squat, you need at least 20-25 degrees.
Wow.
So that's why you're struggling, So you don't have that basic mobility for your rotation. You just have 5 degrees on that, So you mentioned about mobility. So how do you manage with that restriction with your training?
Yeah, I mean, if I don't mobilise for 10 minutes, 15 minutes beforehand, then I'll feel everything everywhere. My knees, my hips, my back. So mobilisation with resistance bands is a must.
Yeah. So we give a lot with this CrossFit bands. A really good workout before USB training.
Yeah.
And playing around the position of your feet as well, and definitely hip strengthening, all your band works, things like that. So focusing on the technique, doing the mobility work as well, and respecting your normal anatomy. That's the main thing, isn't it?
Yeah, exactly.
So is it something which you accepted over time?
Yeah, I think for the first few years it was very much I was adamant that I was going to push through it, and it just seemed to make it worse. So
you sort of not happily accepted, but you're happy with that, sort of.
Yeah, no, like I said, I'm happy that I can work around. It's working around it. So and also another reason why I wanted to hit it early, because I didn't want this to turn into something, and not me, especially not knowing what it is specifically later down the line, and then being even worse.
So I think because you're willing to adapt, you made those changes. We are able to modify and manage and consider surgery. But if you are a high-level professional player, and maybe then surgery might be an option. So it's not black and white. It depends on how much movement you have, what's the requirements you want to do, and you're expecting. So people like to put in boxes, but in reality, some people can be managed well with physio and rehab modification, but some people that is not enough.
Right.
Then obviously, if you're like doing a professional rugby player, then you always pull your adductors come. Then you might have to think on that.
Right,
So it's having that discussion with the patient and seeing like what's your end goal.
Yeah.
If you can manage, you're training in the gym regularly, so you seem happy from where you are. So that seems to be working well on that. So I think from hip point of view, do you think it's stopping you from day-to-day stuff, and you're?
No, it's not stopping me. Like you say, it's just maybe not giving me everything I'd want to out of my training, but I can, like I said, modify.
And you don't think it's bad enough for surgery or anything like that?
Well, no, I know so far. I think it's because it doesn't get
so
worse.
that's good. So you're happy to maintain on that.
Yeah.
Good, excellent, guys. So I think that was a typical case of early cam hip impingement, which you normally see between the age of sort of 21 to 25. You're 24, I believe, isn't it? So that's sort of your classical presentation. You also get a bit of a late presentation, which we might put in the future. Thanks for watching us. Bye.